Lastly, the bleeding that occurs between periods and after intercourse. Okay. Okay. So the next thing that we're going to discuss is the role of contraceptives in vaginal discharge. Okay. And for this one, I want us to be engaged. Like, if we can engage, that would be great. Okay. Because I'd like to believe that all the women here are on a form of contraceptive. No? Yes? No? Okay. Any form of contraceptive, are you on it?
Yeah,
natural method.
Okay.
You must stop.
I'm using the implants.
Okay. Okay, that's fine. Okay.
For 3
At
years.
least you on the oral contraceptive. Okay, but that's great. Mothers, no.
No.
Okay. Then that's fine.
I used to be.
Okay.
I was doing the injection.
Okay.
Like 6 months one.
Okay. The different
Then-
prepare.
Yeah. Because now I understand my body.
Okay.
Natural. It's
Okay.
working.
Okay. That's great. You don't have to.
Welcome to the club.
You don't have to be on any form of contraceptives, to be honest. It's really up to you. But why I included this slide here is so that we are aware of the side effects of birth control pills, okay? The side effects, the abnormalities that comes with it, and its huge role in vaginal discharge.
Sorry, can I take you back a little?
Yeah, sure.
The first, all this you explained,
Oh, this
all
one.
this vaginal discharge and what. Now, as a married woman, when you discover these things, is there a chance you affecting your husband?
Of course. Definitely. And it can also be the other way around.
Other way around.
Yes.
Okay.
So how we counsel our patients is when they come to the hospital and it happens that they have one of these infections. Obviously, you give medication because you need to treat it. Okay, you need to treat the symptoms. Then you have to abstain for a couple of days. Okay, there are some instances where you have to abstain for a couple of weeks so that you can treat yourself, because definitely it is transferable. Most of these, how many did we say transferred during sexual intercourse? Transferred during sexual intercourse. Most of
So now, when you have it, and you are being treated, does your partner also need to be treated?
Definitely.
That's what it is.
Definitely. You and
But
your
what
partner-
in the case now, the man in question is the one who has it. He refused to disclose to you. You, the wife, you are not aware, and both of you keep meeting. And
That's
the
a
man is in
problem.
denial. So what do you do?
That's a problem. Obviously, in that instance, it will get sexually transmitted. Okay, and then you're going to have it. I would like to believe that you have the knowledge for you to go to the hospital and seek medical help. Okay. The person that will be in attendance to you should be able to tell you that, okay, you and your partner has to abstain for a bit and get yourself treated. If it's the man that he's at fault, then to an extent it has to be addressed, because he's obviously transferring this infection to you knowingly, if I may say, because you said he's in denial, right? So he's knowingly transferring this infection to you. There is no law that states that he can be arrested or anything like that, but it has to be an agreement between the two of you that you have to get treated together.
Okay, like where we find ourselves as Africans, when the man refused to go for, men they hardly go. Now the women, they are the one always in forefront.
Yeah.
Now if the man refused to go, maybe at the end accusing you as the woman, no, I'm not going, it's you. So in that situation, what do you advise the woman to go? Is it possible for her to go get her own
And treat herself.
treated? Yes.
Yeah, you can.
But
It
then,
will,
you
you
come
can
back in
transfer.
again.
You
Take it
definitely can
You
treat
just
yourself
again.
on your own, but for the fact that this is your husband, you can't. It will get transferred.
Maybe I can bring it for you.
So
Put in his soup.
the clinic.
It
must not.
The two of you have to come. Unfortunately, you can't take for him. But in that instance, yeah, it's going to get transferred again. Consistently, and
But the treatment, is it the same? Like if I go with him to clinic, Is it the same treatment you're gonna
It
get?
is the same treatment. However, I know where you're going.
Yeah,
Can
so
you
I'll go and
share?
buy or go and buy to
But if it's an injection,
because
if it's
they'll
an
give
injection,
you-
can you buy injection?
They will give you for exactly
can't.
7 days.
No, it's normally pills.
It's pills.
Yeah, it's
Oh, no
pills.
injection.
They will give you
Not
for,
injection.
but injection depending how severe
How
it is.
severe?
Yeah.
Okay.
Okay. They will give you for exactly 7 days.
So you can't
Then
share.
I'll go buy 7 days.
It's a famous.
Yes.
Same
No, I think men also should be enlightened, you know.
Of
understand?
course.
They should.
Definitely.
When they come to clinic, I don't know how to know.
Do
men,
they even
hardly
go? There's
They
no
don't
men
even
go
go
to
to
clinic.
clinic.
They
They
go
don't
to
even
clinic.
go
If it's
to
cold,
clinic.
he will cough until he's fine.
True.
When they go, they are really sick
No,
and they
there's
see
something
that they are
normally
dying.
When
have-
it becomes
they call,
severe,
I don't know
that's-
what they call, whether it's drop, is it,
Which drug?
That's STD.
is STD,
Is the one they call drop.
like they can't pee, the thing is like if they fall to swallow, even to walk they can't.
No, I'm understanding you. I'm understanding, and that's the sad part because they wait for it to be severe.
Yeah.
Then they go and seek medical help, and obviously it becomes it becomes more complicated to even treat. If I'm being honest, because the minute you identify it early, the minute you're able to see, okay, there's something wrong, there's something besides the norm that is happening to my body.
Yes.
It needs to cause an alarm for you to go and get it treated, but men are different.
Yes.
If I'm being honest, that's why us as the women, we are the pillars of the household. If we're being honest, you know. So if you feel like there's something not right in my body, and you go and seek medical help, and your husband is refusing to actually follow you because the two of you have to get treated,
Yes.
then in that instant you have to talk with him. There's no law that will stop him from going. You can't get him arrested, and at the end of the day, he is your husband. So intercourse will happen, and the infection will get transferred. You have to talk to him so that the two of you can get treated. To be honest.
Can I ask again? Do men have discharge?
Of course. Sorry. Of course they do.
They have
Yeah.
discharge.
They do. Most of the time, they do have discharge, but because the area in which they pee is the same area in which the discharge comes out from, it gets misinterpreted. But definitely they do.
It will be white.
Yeah, it depends on the color, depends on what condition it is.
Not just say maybe
So
they-
they'll get the same, like
Yeah,
if
if
they're
it's an
suffering from that,
STI, yes.
it will green yellow, same like women.
Even genital herpes. The genital herpes is bad, to be honest.
You know, sometimes women can miss, like when you see such things, you
Yeah.
assume, no, this man is cheating
Cheating
on me.
also.
Yes.
Whereas he isn't. You understand? Maybe the man unknowingly to him that is this thing also is dangerous for
So
him.
it's something need to be treated.
So
also.
Yeah, definitely. He needs to get treated. Sorry,
in that situation, what kind of advice you as the wife can you give to him instead of accusing him now that no, you are cheating? I see this in your pants or in your undies.
Yeah.
No, obviously, if for it to get severe, it must have happened to you as well. If it's an STI, because the way you're describing it, if there's like a discharge, if there's because men don't just experience normal discharge like we do. Women, it's normal for us to experience discharge. Okay, it can be healthy, can be unhealthy. But once a man experiences a discharge, it's as a result of an infection becoming severe. Okay, in most cases it can be an STI. So if he has this, then you most probably have it. So it's best the two of you get treated together. Okay, and in terms of cheating or the whatnot, that's between the two of you. There has to be trust between the two of you for you to even, or there may be maybe no trust between the two of you for you to say he's cheating or whatsoever.
Okay, assuming for a period of time we've not been meeting ourselves, and I discovered this thing in his pants. We've not been meeting, but I discovered it. Unknowing to him, or will he be aware that he's having a problem?
He should be.
That discharge of a thing.
He should be aware that he has that.
Is
Because
there
I mean,
any
it's not.
kind of feelings?
There will be
or
pain.
pain?
There definitely will be pain. There will be a discharge, as I said, but obviously that will be in severe cases. because men don't just experience discharge as normal.
Okay.
Okay, so there will be a discharge. Then I hope that this person is knowledgeable enough to know that this is not normal.
You may not know, that's why.
Yeah, that's where empowerment comes in.
Okay.
That's where empowerment comes in. That's where knowledge, spreading of knowledge comes in. To be honest, because if they don't know, then they won't get it treated. There'll be no.
Yes.
He wouldn't know.
In that situation, can I tell him, come,
Of
can
course,
advise him, let's go
Yes.
to the hospital so that you
definitely.
see what
But
is
in the
going on.
instant where I think Sister Babalo, you said he doesn't want to go with you, what then happens? Then that's a discussion that the two of
The
you
two
have.
of us, we can
Yes,
iron that. Okay.
yes. But you have to take him to the hospital. STI,
Highlighting
vaginal-
him the danger
Yes.
of what you are saying. Eh?
Exactly.
Okay.
Exactly. Because at the end of the day, you're protecting yourself as well
It's
when you
true.
protect him. Because he is your husband.
Mm.
At the
At
end,
the end, yeah.
you tell him you get this after you go to clinic.
True. Women do understand, yeah. No, women.
This you get after you go to clinic.
No, it's okay.
I mean,
Yeah.
It's
Of
the
course.
the means of
Yes, and if he's a husband that loves you dearly, then
we do it.
he will do it. Yeah. Okay. Okay, so the next part we were talking about was the role of contraceptives in vaginal discharge. Okay? Sorry, just make sure. Yeah. So the role of contraceptives in vaginal discharge. Okay? The reason why I included this this topic, if I may say, in today's talk is women basically, well, I was about to say every woman, but now I see that there's a consensus. Not every woman is on a form of contraceptive or a form of family planning, okay? But most women that are on it complain of vaginal discharge as being the greatest symptom and sign as a result of the contraceptive, okay? So that's why I wanted us to discuss it, okay? Vaginal discharge is a healthy bodily function resulting from natural changes in estrogen levels. Okay, so just to explain that, the natural changes in estrogen levels, né? I don't know if any of you guys have ever experienced during your menstrual cycle, né? Besides you bleeding normally, the blood that comes out has a specific consistency and a specific viscosity, like it's thick.
Yeah.
Yeah.
Clots.
Clots, yes, the blood clots. The clot is formed because of mucus mixed with blood, if I may say. Okay? So what happens during your menstrual cycle and during ovulation when estrogen increases? Yeah? You guys know what is estrogen, right? Estrogen. So estrogen and progesterone is two hormones that are produced in our body. Okay? These two hormones are distinctive to women. Okay, in the sense that it's produced in our ovaries, and these two hormones controls menstruation and ovulation. Okay, so on a monthly basis, when you menstruate and you ovulate, it's as a result of these hormones increasing and decreasing in our bodies. Okay, and it starts from as young as 13 till 55. Okay, so when these estrogen levels increases in our bodies, there's also an increase in mucus in our bodies, in our vagina specifically. Okay, so what happens is when the estrogen increases, the cervical lining, okay, and the uterine lining in our body starts thickening up. So the thickness of it is as a result of mucus buildup. Okay, and then during our menstrual cycle, when the estrogen decreases, the mucus comes out. And the mucus comes out with blood. Okay. So the mucus coming out with blood, that is what distincts us having vaginal discharges. Okay, so that's why I said as women, it is normal, wire, because of the estrogen in our bodies. Okay, but the thickness of it is as a result of estrogen. Okay, the same thing we see in contraceptives. So us as women, when we take contraceptives, we're taking the synthetic form of estrogen. Okay, contraceptive, its role is to balance out our hormones, is to protect us from having unplanned children, basically family planning. Okay, but one of the biggest side effects is the discharge, the increase in discharge. That is as a result of you taking a double dose of estrogen, if I may say. Your body is producing its own estrogen, you know, that controls its menstrual cycle, controls the eggs, you know, as normal. Now you are taking an additional quantity of estrogen. Obviously, your vaginal discharge is going to increase. Okay? The amount of discharge can increase from the likes of ovulation. Okay? During ovulation, you have a huge increase in vaginal discharge. Remember, it's clear white. Okay? Sexual arousal. Okay? Birth control pills and pregnancy. Those are the instances where you have an increase, a greater than normal vaginal discharge. Okay? Now just to talk about how it contributes. Okay, before we talk about how it contributes, sorry, I wanted to touch on something. Yeah? So there are two different types of oral contraceptives. I'm going to focus on the oral ones because the oral contraceptives are the ones that brings about the biggest vaginal discharge, or the biggest vaginal discharge, which ends up to be the biggest side effects, if I may say. Okay, the patch, the intrauterine device, the injection, they don't bring as much vaginal discharge as your oral pill, the monthly tablets, the daily tablets, sorry. Okay, and that is as a result of the estrogen in it. Okay, so there are two types of oral contraceptives. You have your combined oral contraceptives and you have your progesterone oral contraceptive. Okay, so the combined oral contraceptive is made from synthetic estrogen and synthetic progesterone. Okay, remember I said that these two hormones are produced in our bodies. They're produced normally. It is responsible for ovulation, ovulation, menstruation, basically the womanly function. Okay, these two hormones are responsible for that. Now you take the combined oral contraceptive that has the synthetic progesterone and synthetic estrogen. As I said, you're basically doubling the normal quantity in your body, because now it's the synthetic plus your normal natural formulated ones. Okay, in patients that take the combined oral contraceptive, you're going to have an increase in the vaginal discharge. That is just normal. Okay, then the second type of contraceptive is your progesterone only. Okay, so that one has no estrogen in it, and hence that one has produces less, if not nothing, in terms of vaginal discharge. Because remember, we said the mucus buildup in our bodies is as a result of the estrogen. So in your progesterone only contraceptives, you have no vaginal discharge greater than normal. Okay, so the contraceptives I'm talking about are like, for example, your Yaz, your Trifazole, Diane. Are these names familiar? No? Trifazole, they give it a lot in government hospitals.
No, so I'm not choosing the one for you.
You're not using, oh, okay. Oh,
They're
okay.
different.
Okay, okay. But is it the combined oral contraceptives or is just the progesterone only?
The color of the pills.
No. Is it the 2-in-1 or it's just the one?
Is
You
it
don't
brown,
know.
white?
red.
No. The colors are all the same.
Oh,
The colors are all the same because it has the same estrogen, progesterone. It's the same. But in terms, I'm talking about is it the combined? Is it the 2-in-1 or just the one? Not sure. Okay. No, try and ask them when you. No, please ask them. Like the sister that wherever you get it from, ask them which one you're taking. Because remember, you're putting this into your body. You need to try and be familiar. Ask them which one you're taking. Is it the combined oral contraceptive? Oh, first of all, wait, are you experiencing any side effects? Nothing. Okay. There is most probably, so there's no discharge that is unusual. There's
nothing.
Okay. Oh, then you're lucky.
That is why I take it. I was taking the other one, whatever.
Trifazole.
Yeah.
Trifazole has a lot of side effects.
I left it.
Trifazole has a lot of side effects, to be honest. Besides the discharge, it has weight gain, it has sore breasts, it has osteoporosis, nausea and vomiting. Nausea and vomiting. Yeah, no, legit. Triphasia has a lot of side effects.
So the one I'm taking now,
No, me, I'm using the one they
Injection.
Yeah, that's what
I don't think tablets.
Okay. No, that's what. That's
For
what.
that one
They,
is fine. I
Mm.
don't have any side effects.
Okay. The injection one is just the
No, it's
progesterone.
not injection,
You
it's
just
implant.
Yeah, the implant. Sorry, not the injection.
Is nice.
The implant is just the progesterone. It is good.
So should we go and do it?
It's up to you if you
But
want.
is
What?
nice that one?
Yeah,
it's nice.
Is it going to make
It's
you
nice.
big?
No.
It will cause. Okay, actually no.
Natural is best, guys.
It can
Yeah.
cause
Actually,
weight
natural,
gain, but
yeah.
not.
You don't
Yeah.
want ovulation. When
When you know, yeah, there's some women that just do it naturally, and it's also perfect. If it works for you, then that's great.
And me now you're living.
And you
I don't
don't
use this.
Good girl.
Natural.
If it works for you, no, sincerely, every
But it
woman
takes
is
one
different.
For you to understand your body,
Yeah.
because
Yeah.
you can find yourself pregnant. and
Yeah,
you're not following.
Legit.
It's also
Yeah.
scary, that one.
No,
It's very,
No,
very
definitely, it's up to you. If you want to go natural, then by all means go natural. If you want to use the injection,
you know during this period, when those thick blood comes,
You will jump like
sometimes I'll be scared and say, hey, you see, baby, a baby. See,
Yeah,
so
you are not sure.
that's what we say.
that one.
Go to hospital, go and check. It's
Not
not,
that.
you know, that kind of
At
thing.
times you feel
Now-
like with this natural one month you feel like
No.
I'm messed up.
Mm.
You start counting
So
days
every
together
time you have
until
to live
you
without
celebrate.
Peace.
But if you know how, like she said, if you know your body, I mean when,
Yeah.
and also your husband, if he knows,
If he's
like
helping you.
my
Because
husband
they calculate
knows better
better,
than
they
me.
know.
oh, that's
He
great.
knows
You
better
tell
than
you,
me.
don't touch
They'll
me.
say, no, not inside, inside, out.
No, but that's great. Once you know your body,
Yeah.
then there is no need for contraceptives.
I told you not to
Not inside.
It will be
Too much. And by that time now, the person is pushing you, are pushing out.
Me, I have evidence for chicos. The chicos was natural prevention.
okay.
I have evidence.
Okay.
So
You
I'm
are
not
doing
doing
that. Then you've
I'm-
don't know your body then. Okay.
But it's not easy.
But everyone is different, you know.
Yeah.
And
Yeah,
also
you
don't
can't
feel,
do because
yeah,
this one is
exactly.
doing
Don't feel
it.
influenced.
Yeah.
Don't
Yeah.
feel influenced.
Do what's
You
best
yourself
for
know
you.
your
You know
body.
yourself.
Yeah.
If
We
you
are
know that
different.
you work well with contraceptives, or you
go
know
ahead.
that you and your husband are spontaneous,
Mm.
hey baby, come, let's go. Then you know how to control. To be honest,
Yeah.
you know how to control yourself. Okay. Okay. So, how birth control methods contributes to vaginal discharge. So as we said, like the patch, the intrauterine device, and other forms of hormonal contraception, the pill is generally safe, effective way to stop yourself from becoming pregnant. Okay. Despite this, it still has several common side effects that appears after you start using it. Okay. One of the potential side effects of the pill is an increase in vaginal discharge. If you have just started using the pill, you might notice an increase in white, mucus-like discharge from your vagina, especially during the first few months. Okay, so this is one of the side effects that they complain of. The first few months, you see an abnormality, but best believe your body then your body adjusts, your body goes back to normal, your body gets used to this because the amount of estrogen and progesterone you're taking now on a daily, it will be consistent and it goes back to normal. Okay. If your vaginal discharge isn't itchy, isn't uncomfortable or irritating, and it doesn't have an unusual odor, it's most likely just a harmless side effect of the birth control pill. Okay, so if your discharge is there's no smell, there's no pain, there's no irritation, there's no odor whatsoever, but there's an increase in quantity, then it's just as a result of the pill if you are on it. Okay. If your vaginal discharge is painful, it has a smell, so it's smelly, or causes any kind of discomfort, okay, it's best to talk to your healthcare provider where this kind of discomfort is not typically associated with the pill, okay? And it could be caused by a bacteria or fungal infection. Okay. Okay. So I'm just to go through treatment or management remedies of vaginal discharges if you are on the contraceptive. The first one is to wait. Wait for it to stop naturally. As we said, the first few months you will experience side effects, okay? But your body will adjust. Your body will get used to the normal concentration of estrogen and progesterone that you take, you know, everything subsides, everything goes back to normal. Just wait for it to happen naturally, okay? The second one is switching to another form, okay? Like the way Tembi, switching to another form of contraceptive is also ideal, okay? If the side effects that comes with triphasal or with Yaz or with Diane is too much for you, feel free to switch, okay? Feel free to switch to the progesterone only ones. Progesterone only pills, the injection, the patch, the intrauterine device, whichever. Feel free to switch if you don't feel comfortable. Okay. The next one is to seek treatment for an infection. Okay. So if it's outside the norm, okay, and you're not on the pill, then it's most likely is an infection. Okay, so feel free to please seek for treatments. Okay, then the last one is to learn more about the side effects. Okay, you taking this thing into your body, you're introducing your body to this thing. Okay, understand what you're putting into your body, understand your body perfectly. Okay, understand what is normal, what is not normal, understand what looks normal but isn't normal, you know, those kind of things. Just basically knowing the side effects of the pills, of your injections, whatsoever. Okay, yeah. Okay, so that was on contraceptives and vaginal infections. Are there any questions before we move on? Are there any questions? No. All right. So the next discussion we're going to have is on urinary tract infections. Okay. So as I said earlier, the reason why I included this topic is because it's something that we see in the hospital very often. Okay. And because it's women tend to ignore it and not treat it early, it then progresses and becomes complicated. Okay. And also because of the anatomy of the woman, it's a thing that's more prone in women as opposed to men. Urinary tract infections, women get it very often as opposed to men. Okay. And that is as a result of the length of our urethra. So the urethra is the small part just beneath the bladder, okay, where the urine comes out. Remember, the bladder is a storage house for urine. So the urethra is the small tissue, the small muscle just beneath it. In women, it's about this small, whereas in men, it's way longer. Okay, so obviously, they are less likely to get the infection as opposed to women. Okay, so just to give a description of what urinary tract infections is, I got this definition from the standard treatment guidelines. Okay, so it's this textbook that we use as a reference guide in all hospitals. Okay, so I got this definition from there. It says urinary tract infections is an infection which, because of the anatomical continuity of the system, it involves part of or all of the urinary tracts. Okay, uncomplicated cystitis. Okay, which is the inflammation of the bladder. So cystitis is the inflammation of the bladder. Remember, the bladder is the storage house, okay? And uncomplicated cystitis is a lower urinary tract infection in a non-pregnant woman of reproductive age who has a normal urinary tract. Okay? Uncomplicated cystitis is a urinary tract infection in a non-pregnant woman. So this simply means any urinary tract infection that we get as women whom is not pregnant, it is seen as uncomplicated. Okay? Anything outside the norm, okay? For example, if you're pregnant, okay? If you're diabetic, okay? If you don't treat it, it now becomes complicated. Okay, so urinary tract infections are generally uncomplicated if you don't treat it. Okay, unfortunately, once you become pregnant, it becomes complicated. I don't know if anyone has ever experienced a urinary tract infection when they're pregnant. It's very common. Have you ever? Would you like to share? No. Okay. Okay. The urinary tract infections are very common in pregnant women. Okay, urinary tract infections and vaginal infections are very common in pregnant women. Okay, that is as a result of your uterus being very close with your vagina. Okay, remember you're pregnant, your cervix is open, your vagina is open, you know, it's a nice atmosphere for bacteria and fungus to, you know, have a party there, if I'm being honest. Okay, so if you don't treat the vaginal infection, it can progress to become a urinary tract infection. Okay, because of the close proximity. Can you see how? Can you see? You see where the? Oh, it doesn't show. So the opening over here. This is your vagina. This is your urethra. So there's a it's so close to each other. Okay. Once you're pregnant, this opening widens. Obviously, okay. It allows for bacterial growth, fungal growth, for whatever to grow inside there. You get an infection. It then transfers into the bladder. That's why it's so common for women to get urinary tract infections and vaginal infections. It's also not something to be embarrassed about because it's because of the nature of your body, to be honest, because of the nature of your body. So once you become pregnant and you have a UTI, it's considered complicated. Okay. All other urinary tract infections are regarded as complicated. That is, pregnant women are prone to getting complicated UTIs due to the nature of their body. Okay. Okay, so we're just going to talk about signs and symptoms to look out for when you have a urinary tract infection. Okay. Urinary tract infection presents with a burning sensation when you urinate. Okay, it will burn. Okay. The reason for it burning is because, remember, when a person has a UTI, yeah, it's an inflammation. It can either be in your bladder, it can either be in your urethra, so that's the space above your bladder, or the not the space, sorry, the tubing, if I may say, above the bladder, and the urethra, the tubing beneath the bladder. Okay, so any inflammation that happens in that area is going to pain. It's going to burn. Remember that the lining of the tissue is what is inflamed. So you will have a burning sensation when you urinate. Okay? You have something called dysuria. So that's difficulty when you urinate. So difficulty, pain when you urinate. Obviously, the muscles in your bladder is contracting and relaxing continuously when you go to the toilet to pee. Okay? So it has to do this work. So the minute it becomes sick, if I may say, it presents with pain, it presents with inflammation, presents with a difficulty in urinating at the end of the day. Okay. There's pain and inflammation and discomfort when you urinate. Okay. It is tender to the touch. So when I say tender to the touch, it means you see when you urinate and you use a tissue to wipe. Okay, I don't know if you've ever experienced where you know that the opening in the urethra, this small space is actually on the outside of our body. Do you guys know that? The urethral space is on the outside of our body. Okay?
The one on top.
Yes.
Okay.
No, yes, that's what it is.
Okay.
That's the urethra. Okay, so after you go to the bathroom to urinate, when you wipe, it's sore. It's tender. Yes. That's a sign of a UTI. So it's tender to the touch. It's sore when you touch it. Okay. You experience lower abdominal pain, so a lot of pain around this area. Okay. Blood in the urine. That is not good. Your urine is a sterile area, as opposed to your vagina. Your vagina is not a sterile. Your urine is sterile. Okay, so any blood in the urine is a cause for an alarm. Okay, it can be that the bladder is infected. It can be that the urethra. It can even go up to your kidneys being infected. Obviously, if you don't treat it. Okay, so blood in the urine is a cause for an alarm. You most likely have a UTI. Okay. It presents with a cloudy, turbid color that is interchangeable with the mucus discharge. Okay. Remember, our bladder is also made. The inner layer of our bladder is made of a mucus layer. Okay, the same layer that we find in our vagina, right? So if there's any infection in that area, it will produce mucus. Okay, so if you start experiencing this mucus when you pee, then it's a cause for an alarm. Okay, it presents with a strong odor, so your urine now has a smell. Most times it's an unpleasant smell. Okay, and then the last one is a constant urge to urinate. Okay, in most cases, so your bladder obviously is the storage place for urine, right? If you're feeling pain in that area, if you're feeling pain in that area, if you're feeling inflamed in the area, you want to get the urine out. So in that instant, you start having this urge to pee because you want to get it out because it's painful inside. Okay, so if you experience something like that, it's definitely most likely is a urinary tract infection. Okay.
So what are the other causes for constant urge to urinate?
Diabetes also.
Okay.
There's diabetes, high cholesterol also, kidney infection, if I'm not mistaken. Yeah, those are the few that I can think of. Yeah. Yes, ma'am.
Okay, I was saying the urge to urinate, like you are taking maybe lots of water. That one is as a result of water intake. The urge to go.
Most likely, yeah. Yes, most likely.
That
Because I
one
mean,
is it okay?
if you, yeah, it's okay. If you pee and there's no pain when you pee, or it doesn't burn when you pee, then it's normal.
Maybe because of the quantity of water, you are pressed, you want to go, and it's not that you are feeling pain.
Then that's
because,
normal.
okay.
That's normal. Yeah, that definitely is normal. Okay. Any questions?
Yes.
Urinary? Yeah, sure.
Not based on what you've said. In terms of shaving, how is a woman supposed to shave, and what is the recommended shaving stick that a woman should use?
In terms of shaving?
Yeah, because I know when I was in school, they told us not to shave until you're like a bottle. You need to leave like some hair. If possible, just trim with scissors. Don't shave.
Yeah.
So what is like your take?
On shaving, that's a good question. But I wouldn't say it's not good to shave, because obviously you need to keep down there clean, if I may say. Okay, why people say don't shave is because of the inflammation that comes with it. Okay, if you use a razor blade to shave, you get those lumps and bumps.
It's itching.
It starts itching. Yes, it's as a result of the razor blade. To be honest, like even when men shave, the bumps and the lumps that they get is as a result of the razor blade. Okay. Some people, in that instant, you would use other remedies. In that instant, you will use other.
Answering your question.
In that instant, you would use other methods to trim down the hair. Okay, shaving is not bad. Shaving it's good, obviously, but the method in which you shave is what you need to look at. Okay, using a razor blade, it will cause the inflammation. It will cause the lumps and bumps. Okay, so it's something that you not.
To everybody.
Yeah, not to everybody. Most definitely, not to
You must know
everybody.
which one you are
Yes.
using. Then if you use razor blade, then you know which one is your.
Yes, shaving is yes, you have to shave.
Yeah, I know, because like they told us, like when we were at school, don't shave until your vagina is as clean as a baby's skin.
Yeah, but
Just trim it.
that in that instant is so that you don't harm your skin. To be honest, you don't harm your skin. Some people use scissors. Yes, some people trim it with Some people wax. Some people wax, get it out one time. Some people use laser. So the method in which you use hair removers, the method in which you use is what is up to you. But shaving, definitely you have to shave. Yeah.
Okay. What if after you finish shaving, like me now, if I finish, I usually use the shaving stick because my hair grows too much.
Okay.
Then afterwards to be itching me, even on the road of like. Honestly, it will be itching. What should I like? Maybe after shaving, should I put some?
You can put a balm, Vaseline, most
Vaseline,
likely.
use Vaseline.
You can use a balm, you can use oil even. Normal oil, yeah. And it, you know, the itchiness is as a result of you tampering with the skin. You understand? So I mean, if you I'm trying to think of something. Any trigger that happens to your skin, it will get inflamed. Okay? So using balm, using a coolant, using a lubricant just to cool down that skin. That's something that will help. Okay? So it's not that you mustn't shave. We all have to, okay? But the method obviously is up to you. And also if you experience the side effects to using a shaving stick, you can try another one. But in your case, you can use Vaseline. You can use Vaseline. You can use, even some people use E45. The E45 cream. It's a natural cream. You can just apply it in that area. And remember, it's a cream. It's cold. It will cool it down. Because the inflammation is because you tampered with the skin there. So something to cool it down would be perfect.
I use both. It's good.
Then if you like,
I mean, I don't shave it.
Yeah,
don't grow.
like
What
that's what
about
I'm
you don't have it?
You
You
like
know,
No, that's what I'm
Yes.
saying. I want to say.
I'm
No, she said you must shave. So if it doesn't grow,
No, she's not saying like if it doesn't.
It's good.
So
I
you want
don't
to
have
shave what?
hair.
the little one
Yeah,
that
what
is there, that gets old, you need to at least to remove it. Then
And bring
fresh,
you
fresh one.
Let's see.
I don't know.
No, I want to sit there.
No, yeah, as you see here, here is the same here. That's how it is. So
There's no
there's
addiction.
There's
No,
nothing
no,
that
no,
don't
no,
change.
Nothing. Wow.
Some
You
people don't
have
tell.
nothing.
Like mine, you can even
There's
plate
nothing.
it.
That's what I'm
No.
saying. Like my own is like this man
So
here.
I don't leave it. I shave.
Yeah.
I shave. Then you apply.
Mine is too
E45
much, just like
or
my
Vaseline.
hair.
yeah, I
It's
think
too
it's
much.
you tell my own I don't.
Because we
Yeah, yeah,
it's
yeah.
too much.
And I was thinking to put relax so that it
To go and plate.
So that you go and play.
Okay. Is there any questions to the UTI topic? Any questions? Okay. This is the last topic of the day.
Okay, maybe before you go to the last topic,
Yes, ma'am.
for the benefit of our sister that just came, just a kind of
Highlights.
no, not all. Maybe
Okay.
just
Okay.
summarize.
So okay.
We are doing that for you, ne? So listen to him.
Okay. So the topics that we chose for today is something pertaining to women. Not something is pertaining to women. Okay. So the reason why we chose the reason why I chose these topics is so that we can create a platform to discuss about it. Okay. We spoke about vaginal infections. We spoke about vaginal discharges. Okay. We spoke about the different types of discharges that comes out from a woman's body and basically what they represent. Okay. The colors, the smells, whatever it is, what they represent. Okay. Should you be concerned about it? Should you not be concerned about it? Okay. We also spoke about urinary tract infections. Okay. Before that, we spoke about contraceptives. Okay. The different types of contraceptives that increases your vaginal discharge. Okay, I'm going to go into that. Okay, the patch, the tablets, the intrauterine device, whatever contraceptive that you are on. Okay, increase in vaginal discharge is one of the side effects. Okay, and it's one of the side effects that women complain about. Okay, so that's why I decided to include it. There are other methods of contraceptive that you can switch to if you don't like that side effect. Okay, we also spoke about urinary tract infections. Okay, urinary tract infections. It happens in the urinary tract. If I say urinary tract, it can either be in your bladder, which is the storehouse of urine. It can be in your urethra, so that's the tissue just beneath the urine, or it can either also be in your ureter, so that's the tissue above your urine. Urinary tract infections can even happen in your kidneys. Okay, in which that's now really severe. Okay, but we having this discussion so that you are aware of the conditions that or the infections that happen, so that it doesn't progress to become a complicated condition. Going back, we spoke about vaginal infections, we spoke about what it is, and we spoke about vaginal discharges, okay? We also then spoke about the colors, as I said, okay? The clear discharge indicates a normal, healthy discharge, okay? However, it's also present in pregnant women, it's also present when you're ovulating, it's also present when you have a hormonal imbalance, okay? So the clear discharge is a normal discharge, right? It happens to each and every woman, okay? But once the color changes, that's when you need it. There has to be a cause for an alarm, okay? Something is different. If the color becomes white, it might be a presence of a fungal infection, okay? A yeast infection. If the color becomes gray, it's a bacterial infection called bacterial vaginosis, okay? If the color becomes yellow-green, it indicates an STI, okay, which is not good, okay? If the color becomes pink, it indicates some form of infection that happens to the cervix. So whether it be cervical bleeding, or vaginal bleeding, or vaginal irritation, or implants. So females that have implants as a form of contraceptives, it may be that the implant was not put correctly, and then you start bleeding. You will see this pink color, okay? Pink vaginal bleed, okay? And then the last color we spoke about was the red. Okay, red is the most commonest because it happens during our menstrual cycle. However, if it's a discharge that happens outside of your menstrual cycle, it may be that you have a cervical infection. It may be that you have a cervical polyp. Okay, a cervical polyp is. Have you ever experienced piles? Piles. Piles is it's a condition that happens in your anus, okay, which produces difficulty in you passing stools, pain and difficulty in passing stools. Have you ever experienced that?
Yeah, my back, my stomach.
Okay.
I'm saying my own was caused because of pregnancy. I was told that there's a lot of pressure.
Oh, you had a cervical polyp in your.
No, like when I was pregnant,
Okay.
my first pregnancy, like
Okay.
I had piles because of the pressure.
Oh, okay. Oh, okay. That's new. So is it piles? Well, piles in your rectum, right? Not in your vagina. Oh, okay. That's new. Well, it makes sense because I mean, obviously, as a result of the little one growing, your body things moved, things shift around, right? And obviously the pressure is increasing, so it makes sense. Yeah. Okay. So cervical polyp, right, is when the inner layer of your cervix or the inner layer of your vagina, yeah, the tissue, the inner tissue, starts protruding out. Okay, and once it starts protruding out, obviously it will cause pain. Okay, it will cause you to bleed. Okay, so that's called the cervical polyp. Okay, it's easily diagnosed because obviously if you start feeling pain and bleeding around that area, you go to the doctor does a scan, the doctor examines you. It's easily seen inside the microscope, if I may say. Okay, because it literally protrudes out like this and stands out. Okay, so that's a cervical polyp. So that also produces a red vaginal discharge because you're bleeding. Okay, and then the last one we spoke about was endometrial or cervical cancer. Okay, so any form of cancer not any form, cervical cancer produces a red discharge that is also can be misinterpreted as your menstrual cycle. But as we said, if it happens outside the menstrual cycle, any bleeding actually that happens outside of the menstrual cycle, it should be a cause for an alarm. Okay, then we went through this table. The table is long, but basically what we were speaking about was the different types of vaginal infections and the different types of vaginal infections and how they present. Okay, in relation to the colors. Okay, so like for example, bacterial vaginosis. Okay, it's a bacterial infection in the vagina, but it's not the presence of a bacteria; it's the imbalance of a bacteria. Okay, the vagina is not a sterile area. Okay, it's a non-sterile, meaning bacteria, fungus, viruses, they live here already. Okay, but once the bacterial and fungal balance becomes impaired, you then get an infection, something like bacterial vaginosis. Okay, This one also presents with a grayish color. So if you start experiencing a gray discharge, obviously it's outside of the normal white discharge, it indicates that you might have a bacterial vaginosis infection. Okay? Then we also spoke about trichomoniasis. Trichomoniasis is caused by a parasite. Okay, so it's a parasitic infection. We also said that for this one, it's most prominent in women that share towels. So women that share towels, that bath together. If you know personally that you're not a hygienic person, okay, and you go to your friend's house and you bath together, you share towels together, you're most likely going to get an infection. Also women that share underwears, share bikinis, share swimming costumes, those kind of things, you're most likely going to get an infection. Okay, that's what trichomoniasis. Then we spoke about yeast infections, okay? Yeast infections is very common. Okay, it happens in pregnant women, it happens in non-pregnant women. It's a very common form of infection. It's very distinctive with its white color. Okay, very white. It has no smell and it doesn't produce any pain. It's asymptomatic, right? Asymptomatic. Yeah. Has no odor, has no pain. It just produces this white color, very distinctive cottage cheese white color. Okay, and you also experience the burning burning and itching around your vagina. Okay, but the whiteness is what gives it away as a fungal infection. Yeah? We then went to speak of gonorrhea, genital herpes, and human papilloma. Actually, gonorrhea and genital herpes, those are the STIs. Okay, sexually transmitted infections. They spread from person to person. Okay, the genital herpes. We said that it has a DNA in its genome, okay, meaning it is latent. So once you contract, if you ever, God forbid, if you ever get a genital herpes infection, okay, it will stay with you forever. It doesn't get cured, okay, because of the nature of the virus itself. It's made from a DNA, so it's a DNA virus, meaning it will stay here. It's recurrent. Okay, so you can treat it when you first get it, but it doesn't go away. You treat it continuously once it comes up. Okay, so that is that. We then spoke about pelvic inflammatory diseases. Okay, pelvic inflammatory diseases is not an STI. Okay, but it can become an STI if you don't treat it. Actually, no. It progresses into an no. Wait. It's caused by untreated STIs, sorry. Okay? So pelvic inflammatory diseases is caused by STIs that you don't treat. Okay, so very important. Once you experience any things or changes that happens to your body that are outside of the normal, okay, you need to seek medical help. Okay. Then we spoke about the last one, the human papilloma virus or the cervical cancer. Okay, so human papilloma virus is the least common form of STI. That is as a result of the vaccine that is given to young girls. Okay, so it does have a vaccine, so you can manage it from an early age and you can stop it from spreading. Okay, so human papilloma virus, that was it. Then we spoke about the roles of contraceptive. We spoke about the role. We spoke about the roles of contraceptives in vaginal discharge. Okay, we said the increase in vaginal discharge is as a result of you taking a contraceptive that has estrogen in it. For example, the combined oral pill. Okay, the tablets. Are you on any form of contraception? Not on any. That's fine. Okay. But if, for instance, you start taking the combined oral contraceptive, the one that has the progesterone, like for example, triphasal, okay? Triphasal is a combined, né? So because of the presence of estrogen, you will have an increase in vaginal discharge, all right? And that is because the estrogen in the combined oral contraceptive, one of its function is to increase the mucus membrane in both the vagina and the cervix, okay? So during the menstruation, when the estrogen drops, the mucus has to now come out because it has no function, and that's what produces the vaginal discharge. Okay, you will see it has a very distinctive consistency. It's now very thick. You know, mucus is thick. So the consistency of the vaginal discharge changes. And that's how we identify that, okay, this vaginal discharge, this is my normal, okay? And then this is as a result of me taking the pill, okay? If you don't like that side effect, you are welcome to change it. Change the contraceptive that you are on, okay? You don't have to stick with that one, okay? Yeah. Then we spoke about how birth control, okay, that's basically what I just said. Okay, that's also what I just said. Then we went to the treatments, the management, okay? We said you can wait for it to stop naturally, okay? You're taking this pill into your body. In the first few months, you will have an increase in vaginal discharge, but your body will stabilize over time because now your body will get used to it. So it will stop naturally, okay? The second method of management was to switch to a different one. If you don't like the pill, you can go and try the injection, or you can go and try the patch, or go and try the intrauterine device. It's up to you, okay? Or abstain. That's up to you as well. If you want to abstain. Okay.
No, you can.
And then you can also seek medical help, seek treatments for any infection, okay? If obviously, as we said, if it's outside of the norm, all right? Then the last one was to learn more about the side effects, okay? You are putting this thing into your body. Try and understand what you're putting into your body, okay? Understand the side effects that you might experience whilst taking this medication, okay? The contraceptive, okay? Then we spoke about urinary tract infections. We then spoke about urinary tract infections. Urinary tract infections is when I've discussed this. Okay, urinary tract infections. Yeah, urinary tract infections is when there's an inflammation to the bladder. Okay, when there's an infection in the bladder. Okay, the bladder is a sterile environment. Okay, your urine is sterile. Okay, there's no infection in it. But once it now presents with any form of abnormalities, there might be an infection in that area. Okay. We spoke about uncomplicated versus complicated cystitis. Okay, complicated cystitis happens. First of all, uncomplicated cystitis happens in non-pregnant women. Okay, so when there's a UTI in a normal woman, okay, it's classified as uncomplicated. But once there's an external force or there's another underlying condition, then it becomes complicated. So it can either be that you're pregnant, or it can either be that you are diabetic also, okay, whatever the condition is, and you don't treat it as well, then it becomes complicated. All right. Yeah, then we spoke about the signs and symptoms of a urinary tract infection. Okay, so what to look out for if you experience anything. Okay, so if you have a burning sensation when you urinate, okay? So when you're urinating, you feel a bit of burn, you might have a UTI. Okay, if you're experiencing dysuria, so dysuria is difficulty when you urinate, so difficulty and pain when you urinate. Okay, pain and inflammation and discomfort when you urinate as well. When it's tender to the touch, so tender to the touch is when you touching your urethra. Okay, do you know where the urethra is? The urethra in the body. So this part, yeah, this part. No, not this picture. Sorry, the next picture. Yeah, this part. This part is the urethra. Okay, and this is the part that is outside of your body. Okay, so when you have a urinary tract infection, after you urinate, when you touch that area, it's going to be painful. So that's tender to the touch. So it's tender, it's painful when you touch it. Okay, so that's one of the signs and symptoms. We also spoke about lower abdominal pain. So when you feel a bit of pain in the lower abdomen, it might also be a sign. Okay, if you experience any blood in your urine, that is not normal or all on its own. Okay, so there's not supposed to be blood in your urine. because it's a sterile area. Okay, there's no bacteria, no fungus, no blood. There shouldn't be. But once there's blood in the urine, then it's a cause for an alarm. Okay. We also said if there's a cloudy, turbid color. Okay, so if there's some form of discharge in that area, it also needs to be a cause for an alarm. Okay. If there's a strong smell, there's an odor to your urine that is outside of the norm, it's also a cause for an alarm. Okay. If there's a constant urge to urinate, so if you always want to pee and there's pain when you pee, then it might be a urinary tract infection. Okay. Yeah, that's where we were. Okay. So now we're gonna quickly go through and finish off menopause. Okay. So menopause, I just wanted us to have a discussion. Okay. In terms of what menopause is. Okay. I just want to find out, is there any woman in the room that is currently experiencing or has experienced menopause? Not yet, okay. Ma, are you not yet? That's great, okay. So I will share the little that I know, because menopause, from what we have come to know, it's different in every woman, okay. Every woman will experience it as it comes, okay. It's a roller coaster, okay. A lot of things happen, so every woman is different, okay. Menopause is basically the cessation of your reproductive hormones, okay. So when your body stops producing estrogen and progesterone that are responsible for ovulation and menstruation, okay. So the body is shutting down its reproductive system, okay. So that's menopause, okay. And as a result of the shutting down of that cycle, okay, your body goes through waves of things happening, okay. Your menstrual cycle stops, your ovulation stops, your breast now becomes very flaccid, okay. It stops becoming perky, you know, your mood starts changing. Some people experience depression, you know, some people experience hormonal imbalances, okay. There's a whole lot that happens, okay. So because of this reduction in estrogen and progesterone in our body, the brain now gets signals that, okay, the quantity of estrogen and progesterone in our blood is decreasing, let's increase it again, okay. Then it will increase it, and then it will decrease. The brain gets another signal, it will increase, and then it will decrease and increase, okay. So because of that whole increase and decreasing till it actually finishes, that's how the woman goes through so many mood swings and depression. And 1 minute you're on your periods, another minute you are not. You can be on your periods twice in a month, 3 times in a month. You can spot, yeah, because your hormones are shutting down, so a lot is happening, okay. You can be on your periods twice, 3 times in a month. What else do you experience?
Sounds scary.
It not scary. You take it as it happens, okay. And also, in that instance, your family has to be very supportive, to be honest, in the sense that you also have to tell them that, okay, menopause has started. There's a lot of things that you're going to experience. From me, just try and be understandable, okay. That's what my mother did to us. Like, she was very cranky, she was very moody, she would snap, she would shout, all sorts of things.
Why?
No, because that's just
The
how
mood
it is.
changes.
The mood changes. Your mood changes. Your body. You feel as if your body is not your own. From what I've been told, okay, you feel as if your body is not your own because your body is now, you know, it's changing, becoming someone else. Okay, some people enjoy menopause. Some people feel like it is. You know, there's actually a woman that I had as a patient in our hospital. And she loved her period of menopause, you know, because everything was just so soft for her, you know. As much as there was a roller coaster, she was being cared for, you know, she was calm, you know, her body was like relaxing. It's different for every person, okay. But the most common is you become depressed, you become moody, and so on and so forth, okay. So it's as women, we will all experience it, okay. There's also something called premature menopause, okay. So menopause happens between the age of 40 and 50 or 40 and 55, but there are some women that experience premature menopause between the age of 20 and 30 or 20 and 40. Okay? Premature menopause, menopause is between 40 to 55. Yeah. Then premature menopause happens between 20 or even 30 to like 40. Okay? Premature menopause is not biological. So it doesn't happen as a result of our normal bodily functions, but it happens as a result of external forces. Okay? In most cases, it's surgery. So in an instance where you have a really severe clinical condition and they have to take out your ovaries, okay? Obviously, in that instance, your body will not produce any estrogen, okay? Then it shuts down. That's called hysterectomy, okay? In women that go through cervical cancer, okay? The chemotherapy that they go through is very harsh. Remember, chemotherapy, as much as it's fighting the bad cells that is causing everything that is causing, it also targets the good cells. Okay, then some women start experiencing hair loss because it's targeting the hair cells. Some women start experiencing their nails start breaking because it's targeting the good cells. Unfortunately, women also experience premature menopause because it also targets the ovaries. Okay, so just try and understand between the two. There's premature menopause, which happens as a result of surgery or whatever the case, and then there's normal menopause. Okay. That's
That
it.
premature, is there any chance of the person conceiving or getting back to normal after?
It will depend. It will depend on how severe the ovaries have been damaged. To be honest, if it's chemotherapy that you can reverse, then yes. But if it's a hysterectomy where they have to surgically remove your ovaries, then unfortunately no.
There's some at what move their ovary. There's some women, they said they want to take it off, they are done giving birth. So is it okay?
It's up to them. Yeah.
There's no side effect to that.
Well, you won't produce any hormones, and if you won't produce any hormones, you won't have children. You won't. Your menstrual cycle won't happen. The only side effect that will come from that is maybe like, I don't know, stress and depression, because now obviously your hormones are not balanced out properly. So, yeah, it's up to them. But removing of your ovaries,
because something is normally this is supposed to be in place.
Yes.
Now you are taking it out. It looks as if there is a gap now.
True. Yeah. So the only side effect that might come out from that is hormonal imbalance. Hormonal imbalance, in which obviously hormonal imbalance brings about stress and depression, sometimes even anxiety. But in terms of physical side effects, I don't think there's any, because during your menstrual cycle, right, when your hormones are being produced normally, properly, your breast is tender, your body, your hips become wide, your body looks nice. But now, once that hormone goes away, I think the only side effect you have from that is, okay, your breast becomes normal, your skin becomes nice, because estrogen is what brings pimples, if I may say. The presence of estrogen brings pimples. So you might have a nice clear skin, there's not much side effects that comes with that, to be honest, besides you unable to conceive. But that was a personal decision, so that's, yeah. Yes, Jenna?
I was asking, what age do women normally experience pre-menstrual symptoms? So like before you, they say like before you start what's it called? Menopause.
Premenopause.
Yes.
Remember premature menopause.
Is it the same as pre-menopause?
Or premenopause before the actual menopause. Yeah. That's between the ages, also between 40 and 55.
Will it just happen? Like, there's no sign that, no, I'm getting that.
No, there will be signs. Signs, for example, hot flashes. That's the most common one. Yes. Hot flashes.
You'll be feeling hot.
Yeah. Because remember, the hot flashes is as a result of estrogen. So as I said earlier, your body produces the estrogen, okay? It decreases, the brain gets a signal to produce more. It decreases, the brain gets a signal to produce. All of those, that roller coaster is what produces the hot flashes. Because you become hot, you become cold, you become hot, you become cold. Definitely hot flashes, yeah. Yeah.
In every...
Hot flashes flushes is very common. Yeah, hot flushes, and it makes sense because of the estrogen imbalances. To be honest, the premature menopause, the pre-menopause, between the ages of 40 and 55, you start getting the signs. The signs I was about to say is like, for example, the inconsistency in your menstrual cycle. Okay, you can be on your menstrual cycle twice in a month. Okay, the changes in your skin, obviously. You know, elderly women have very beautiful skin because they don't have estrogen. Okay, the changes in your skin as well. What else? Your breast maybe starts becoming softer. Okay, but yeah.
Okay, what are the roles if such things are about to take place? What are the roles the family members have to play?
They have to be calm and patient with you.
Only.
To be honest, yeah, they
And
can't.
what again? So that they will hear.
No, sincerely, you just have to.
Open your ear, listen, guys.
No, sincerely, you just have to be calm and patient with them because you
Prepare
can't.
food for
You
the
can't.
person.
But it's not you that is saying. Remember that, I mean,
Taking advantage during that pre-menopause, women want less of sex. Is it
Yes,
scientifically proven?
yes, definitely. There's something I forgot to mention.
Yeah,
That is as a result of vaginal dryness.
Okay.
Vaginal dryness. Remember, estrogen, it increases mucus in our vagina, right? So now, in this instance where you're experiencing menopause, your estrogen is gone, it goes up and down, your vagina becomes dry.
So
The
sex is
intercourse,
painful.
it's gonna be painful.
Use
Exactly. It's
But
gonna
there's some ointment you can apply.
Yes, there's lubricants. There's lubricants that you can use if you want to, but you are going to experience the vaginal dryness. Yeah. Is there any questions?
Not to say they must stop because they don't
You can't stop. Why?
I say you can't stop.
That's
why you
It's now free Mandela, no kids coming.
No counting.
No counting, no more methods. So just
No, definitely. But that's between you and your husband.
Okay, apart from that, sickness wise, is there anything, maybe being sick or something?
Well, I think the well, your bones are going to become what's this?
Weak.
Tender. Weak, yes. Because estrogen also contributes to your bone strengthening.
Okay.
So bone weakness. What are the side effects would you have? I think that's the most common one. Besides all the ones
When
we
you
just
say
discussed,
bone weakness, can you explain?
like arthritis.
Okay.
Arthritis. A lot of women experience, elderly women experience arthritis because of the estrogen lost from their body. Estrogen is what holds our bones together. Yeah. Estrogen also holds our bladder in place. So people that go through menopause, there's a less frequency to urinate also, if I'm not mistaken. Yeah.
big tummy.
No.
No.
Big tummy how, ma?
Less
Some they say when you get to that pre-menopause, see your stomach will develop, look like you're pregnant and you're not. I don't know how true it is.
Not that I've ever been told, not that I've ever read, but I would assume you pregnant, your stomach looking pregnant. I don't know if it's because of. No, I don't understand. Big tummy.
Like maybe your stomach was
Protruding,
flat.
like okay,
Now
gassy.
yeah.
Oh, maybe it's because of the gas. Most likely. Most
Gas.
likely.
So what caused?
The gas is. I
Is it
apologize.
not
I'm not
okay
too
to
sure
check?
exactly what you mean by big stomach. Because I've never
You
heard
know,
of that.
Bloatedness.
Maybe bloatedness. It might be gassy. It might also be, I don't know, your menstrual cycle. Because remember, your menstrual cycle happens more frequently than normal. So
Okay.
it might be that. Might not be that. Can I get back to you on that?
All
Because I want to
right.
make sure I know.
Get
what
back
I'm
to
saying.
I don't know if
Yeah,
it
that's
is
fine.
scientifically proven, but I heard
You heard
maybe
that.
it's a misconception. I'm not sure. Find out for us.
Yes, this menopause, the person is just okay.
The person is, yeah,
Is what?
it differs.
The rich menopause is just fine. But
Yeah, and she reached early at the age of 38.
Oh wow.
She's already.
That age is it not too early?
It is early, yeah.
it's early,
So
and
that-
she's just fine.
She's done giving birth.
No birth, no periods.
No, I mean she's done.
Yes.
I think it
Yes.
differs with
Yes.
because my
Yes.
principal has only one child. So when they were talking, she told me, you know why I have one child? Because I reached menopause when I was 30.
Oh.
So I only have one son at 30.
So I must make fast if I want to have last born now. Okay, don't want. I was thinking I will have one South Africa, so I will push it fast.
Because it's good to be my child. It's good to be my child.
But this in our teacher said it's between you and your husband.
And your
Not
children.
between you and your children.
And your children. Because when you give birth now, it's us that will be waking up at 3 a.m.
All right.
Are there any questions?
And then
Any questions whatsoever? No questions.
I want to ask, but not about what we learn. I want to ask, what is molar pregnancy?
Sorry, what is what?
Molar pregnancy.
Molar pregnancy.
Molar. Pregnancy. Molar. M-O-L-A-R. Pregnancy.
Is it one that grow out of
ectopic.
ectopic
No,
pregnancy?
is it the same?
No, I say it's out of the topic. I said we
No.
didn't.
She's talking about ectopic pregnancy. It's the same as molar pregnancy.
I don't know. That is why I'm asking. What is it?
Yeah, I've not heard of molar.
And
The one I
molar
know is
pregnancy.
ectopic. Yeah.
Molar pregnancy. Okay, if you check it,
Yeah,
let
I'm
me
not
get
really
back to us.
pleased, yeah.
And if you are feeling want to pee every time and you are feeling pregnant,
If you want to pee every time and you're feeling pain, are you asking what you're experiencing? It most likely is a UTI. We just discussed it.
is a problem.
Yeah, in most cases, yes, definitely.
So how do you treat it?
A UTI. There's over-the-counter medications for UTIs.
Antibiotics.
You don't always need antibiotics, to be honest. But if you used over-the-counter medications to manage the symptoms and it hasn't gone away, then definitely antibiotics would be needed. Yeah. You said molar pregnancy, eh? Molar pregnancy.
You can write it.
Don't worry, I know it. Okay. Any questions? No questions. Okay. In the
If I ask, it's not part of what you did. There's this thing they call oral sex. I want to ask, like the men, the Facebook, they teach a lot of nonsense. You see the man sucking the woman's vagina. Is it okay?
Mommy was the female also they suck the penis.
Yeah, because that thing has no.
It's nice.
The man,
Yes, mommy.
the man sucking the.
Yeah.
I don't see anything bad in it.
Yeah, there's nothing wrong.
It's
It's between two of you. There's
and
nothing
also
wrong.
as
There
long
is
as
no
one.
transfer of whatever.
No.
that's what I'm saying. As
From
long as the two of
to
you
the man.
know that both of you are clean,
Yeah.
then I don't see
I don't see
any.
any problem.
It's fine. It's healthy.
You wanna try it?
No, I've been doing it. I just want to.
Because Pastor wants to preach everything around the
Yes.
yours. So
I
you
will
do
tell him what to
Okay. In the absence of questions, I have questions. Okay. And the questions have a
Are
bit
you
of.
ending with the question?
Yes, ma'am.
Okay, can you tell us, like, what are the things we can use? Maybe multivitamins. Is it good for us to take those things? Maybe to boost ourselves. You know, a lot of blood, we lose blood every month. As women, is there anything, or is it good for us to take minerals, those things?
Of
tablets?
course. Yeah.
Like
Like
what?
iron supplements.
Because is it
BPharm causes a lot of weight gain.
Yes, I want
Okay.
that one.
Mm.
It's the one I said.
What do you want to
BPharm.
do?
To gain small.
The brown ones,
One-
the red ones.
The brown.
Yeah.
The brown.
But it doesn't have effects.
No.
Thank you.
BPharm causes a lot of weight gain.
Okay. Big complex.
Yeah.
It will make you to be
complex.
eating.
Yes.
But I want to say something. I don't know.
No,
You know,
but I'm not taking it for
Bill,
weight
I
gain,
don't
I'm
know
taking
if
for-
if food can make you to gain if you don't have peace inside you. Can
No,
you
you
be?
can't. You can't.
But
Can you
this
with
gaining
that-
is not about food, right?
Yes, that
Yeah,
is what
sometimes
I'm. That
it's
is
not
what I'm
about
trying
food.
to say, man.
No, it's not about
That is
food.
what I'm trying to say. Hey, that is what I'm trying to
But
say.
Ije, you said that one doesn't have effects.
So
Because
maybe at the end you tell us the things we can as
Multivitamins.
women use.
Okay, in relation
Not
to
the
your
one that will
question,
make us like some of us we don't want to gain.
okay. So in relation
Want
to
to
your question,
maintain.
you mean like you having a menstrual cycle every month and you losing blood. So what multivitamin do you
Like
take?
as a woman, you know,
Uh-huh.
we pass through a lot. Like
Just
every month. Something to keep you fit.
Okay.
It's gym, mommy. There's nothing.
No, you can take multivitamins.
You can't.
Multivitamins that have folic acid in it.
You can't take.
You can. So
Okay, you can.
You can take multivitamins that have folic acid in it, that have iron supplements in it, your
Okay.
ferrous sulfates. You can definitely
Omega
take-
3, is it fine?
Omega 3 is for
No side effect.
omega 3 supplements. Omega 3 is for the hair. Omega 3 is for the nails.
Okay.
Yeah, you can.
You
Definitely
can take.
Yeah.
Okay. Folic acid.
Folic acid. Folic acid is great. Folic
Like
acid
as
is iron
Biko, you know.
supplements.
Biko, yes.
Definitely vitamin B co, yeah.
Okay.
Vitamin B co, folic acid, iron supplements, yeah.
But that Biko, you take it every day.
Every day.
Yeah.
When you stop,
When I stop,
It won't.
It
what-
doesn't do anything.
So it doesn't really. Vitamin B co is it's a multivitamin complex, okay? And where the greater side effect is the weight gain because you're going to be hungry, to be honest. So yeah, that's
eating frequent.
yeah.
There is lunch.
There's bread.
okay. So in the absence of questions, I have questions. Okay. Because as I said earlier, I wanted this to be an integrated session. I wanted us to learn something. I wanted us to take home something. Okay. It would be futile for us to say that we're here to discuss about women's health and everything, and we don't benefit from it. Okay. So in that case, I have 5 questions. Just to see our understanding. Okay. The questions have gifts to it. Okay. So please participate.
You didn't tell us first now.
No, exactly. So the questions have a small gift to
The
it.
person
Okay?
who
And
will
there's
have a
only
gift
5.
must give my share.
There's only 5 questions. Okay.
Okay.
And only if you know the answer, please
Raise
raise
your
your hand
hand.
so that we
Not
so that
just
we
talk.
have
When you
so
talk,
that we have
disqualify.
so that we have some form of order.
Yeah.
Yes.
Okay. The first question number 1. Yeah? A yellowish green discharge is a sign of what type of vaginal
Let
infection?
them close
their books.
I went into
We didn't even hear. They go and open the book. The question is not even
Why
there.
didn't you write?
Okay.
Let them close the book.
You know.
Sexually transmitted disease like
Yeah.
gonorrhea.
Yes. She got it.
And I wanted
Wow.
to supposed to know it.
Okay. Question number 2. No? True or false? A progesterone only pill increases vaginal discharge.
How is it, Mama Chi?
This one is guessing.
No,
false.
no, sorry.
It's obvious.
You see,
Leave that question.
You see the person that
Leave
answered.
one.
Me, no, it's
No, it
fine.
has been answered. Ask another
She
one.
answered.
What you said
I
to
wanted
me,
to
no,
say
it's
correct.
false. So there's
No, I this one I really know. That is why I just do like this. I know the answer.
Okay, question number 3. True or false? Pregnancy increases the likelihood of having a vaginal yeast infection.
True.
True. Don't space out your answer.
Disqualified.
Disqualified.
Yeah, but it's
Disqualified.
No.
You since that one you jump it, so you give it 2.
But I'm the one who started.
We said 2. Okay, but the 2 of
Two of you, then you answer, then they say two. Give up your hand.
Thank you.
Okay. Okay. There you go. Okay.
Thank you.
Next question. Next question.
Yeah.
When the infection that happens in the uterine tracts has an underlying condition, it is called A, uncomplicated UTI, or B, complicated UTI.
She has got it. I answer.
But mommy, she answered. She raised her hand. Which is wrong.
He said raise your hand.
You didn't raise
No,
your
I
hand.
did. I did.
No, you don't answer first. You raise your hand, then they will point you. Give my point to you, talk.
I point to then you.
You don't say the answer first.
Thank you.
Sorry, Mama, sorry.
Okay, last
Yes,
question.
Just give that one. No, I can't go on without any.
Oh, don't give anything, then that time you do.
This
You
one,
share.
the first to answer.
No, it's for me and Sister Teb. That's
See,
all.
somebody can remember.
Okay, see the girls. See the girls. All of them. Let them just. It's
Mommy, I'm not asked question. What is
no, I'm
Just
Another question.
Last question. Between A, B, and C, which one is not an STI?
listen.
Wait for the question now.
Which one is not an STI? And listen, A, genital herpes, B, bacterial vaginosis, or C, gonorrhea and chlamydia?
B.
You remember the bag. Answer another one.
Ask Mama Chi, then you
What you
ask
answer?
her.
no gift.
That's what.
Give her the cake.
You get the bag.
No, I have the bag of it.
Package.
No, sharing is scary. We'll share.
Please just share, mommy.
Okay.
Thank you. At least I was here.
But
Oh,
sister now.
Sister,
That
okay,
you were
sister.
here.
No, share.
Why did she come late and didn't listen to the question? I only have her.
This
This one.
remember. Hey, change.
Mommy, where is
Let me
the
open
the cover?
It's like that.
It's not complete.
No, it's like that.
Oh,
It's a
okay.
notepad.
So who have again?
Some people will steal pens. I won't bring this one to
Okay,
church.
give one. Give
No,
one.
this one I won't bring to church.
Give one. Give
one,
your sister one.
But I won't bring my own to church. I'll keep it in the house.
Mama Chioma.
I'll keep my own next home.
No.
I'm done. Thank
Thank
you.
you. Thank you. Thank you so much.